Welcome back to Breastfeeding with your girl, Jess. Alright, so I know everything is not always a good time. We want it to be. So, with the good, we take a little bad. Part of the game, part of life. This video is going to be the 5 horrors of breastfeeding. There are plenty more, trust and believe, but these are 5 common breastfeeding horrors that you may have heard about, may not. I don't want it to be the first time you hear about them when you go through them, if you go through them at an education class in the hospital or from a friend, family member. You know, here's your first introduction, if not hopefully your last introduction, because we're going to talk about ways to avoid these things also. So let's get right into it. Number 1, yeast infection. A lot of people don't know that. So yes, yeast can live in other areas other than the southern region, okay? Other than the south of Mississippi. Yeast can also live in your underarms, underneath your breasts, on your breasts and nipples, also in the baby's mouth. So if for some reason, you know, think about this, we talk about moist, dark, damp, you know, just, you know, places that don't get much air. So we're breastfeeding, right? We have our little nipple out, doing our thing, you know what I'm saying? Swinging in the wind, right? We go ahead and put some lanolin on there, or we use something else, a little nipple cream. We may use a nipple shield. We may also go ahead and put like a nipple pad or something like that, and then close them up, put them back in our bra, going about our business, right? Say you leaking throughout the day, little drip, 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 because you know you hear the baby cry, or you see a picture of your baby, or your breasts are full, drip, drip, drip. That can breed yeast. Okay, they just you know having a ball. They just with a party, you know, they're down there, you know, multiplying and dividing, and so then your baby comes and wants a little nibble, a little snacky snack, and you know, attached to the breast. And this repeated breast, well, let this be the breast, and let this be baby's mouth. Breast, baby. This repeated motion of like breast, baby, breast, baby, breast, baby, and you know, closing the nipple up and stuff, it's gonna get yeasty. Just know that, okay? I'm telling you, just know it. It's going to be irritating. It's going to be red. It's going to be ugh. And it's hard to treat because you're constantly breastfeeding. So reintroducing the organism back to the area that we're trying to clean it or get rid of these. That is very, very common. You just need to get a prescription. Oftentimes you need to go see, you know, the pediatrician, because if the baby has thrush, we call it thrush when it's in the mouth, white area, get you a picture, and we'll need to treat the baby, but also treat the breast at the same time. So that is often a prescription for mom and a prescription for baby to combat both. It is very common. It is not a strange, shameful, you know, thing. It happens, especially in the summer months. Baby, we all sweat. We're going to get sweaty. And as those breast tissues grow and we're breastfeeding, it's just the perfect storm. So be mindful, be aware. It's okay. It's treatable. Second thing is engorgement. Engorgement is when the breasts have not been emptied in enough time. So say if you're used to breastfeeding every 2 to 3 hours, right? For some reason, say you had an emergency and you had to go to you know, check on grandma, and you don't have baby with you, but your breasts feel really heavy, and you know, but you're not thinking about time, you're thinking about grandma. Your breasts are going to fill up, they're going to round out, they're going to likely get shiny because the skin is so taut. The nipple, if you do have extended nipples, they will shorten because the excess skin isn't there, and it's gonna be a bit uncomfortable. Okay, you're going to need to empty those breasts, and it makes it harder to breastfeed because baby can't latch on to incy-wincy, nipples. But then also the breast is so round, baby is having a hard time attaching. There are a few mechanical issues with engorgement, but also discomfort, pain, and a lot of times moms think, well, let me pump, or let me hand express, or do all these things. The only thing I would say allow more time for is to breastfeed with the actual baby. I would not pump more. I would not hand express all the milk out. I would relieve the breast just enough to relieve the pressure in them, but maintain some milk in there, because if you completely empty them out, you're going to go ahead and fill back up. Remember, demand and supply. So if you empty them out, it's your body's like, oh, this baby really, that's my cell phone. Your baby really needs all of this milk. I have a big baby on my hands. So now your body's going to regenerate all of that you just did. And I had this one time in the hospital, this patient, we were getting ready to discharge, and I told her, I said, try not to overdo it with the pumping. 20 minutes tops. Like, don't overdo it with the pumping because you will get engorged. She probably came back that same evening. I think we discharged her somewhere, this was years ago, somewhere during the day. And she came back in through the ED and was bawling, crying, did not want to talk to anybody. The ED calls us and we go down, and one, she already didn't like a lot of the nurses, and so they were like, Jasmine, go ahead and talk to your friend. I don't mind. Me and her we built rapport. So I went down there to talk to her, and she's down there pumping. And I'm like, why are you pumping? And she's like, it just hurts so bad. It hurts so bad. It hurts so bad. And I'm like, I know, but pumping, you're just emptying to refill. And yeah, the rest of the story is not appropriate, but I would just say with that situation, what you want to do, relieve the breast, ice after you relieve the breast, and just try to relax. Do not overstimulate, and then just feed your baby and monitor. Okay, that's all I would do. Number 2 leads into number 3. So number 3 is mastitis. Mastitis is when it becomes an infection. So a lot of times engorgement, if the breasts aren't emptied over time, like enough, like the stasis or the milk pooling can become infected and become what we call mastitis. So mastitis is an infection of the breast. And we know it from mom having a fever. She feels really sick, fatigue. It feels like the flu, it feels like you got hit by a truck. It's usually one breast. It can be 2, but usually it's just one breast. One affected area is really red and like warm and very tender, very painful. Unfortunately, here's the thing. We need to go see your doctor, your OBGYN, because they need to prescribe you something for that. But then also you need to breastfeed. I know, and it's the worst because you already don't feel good, the breast hurts. You need to breastfeed because that's the only way to get that out. So breastfeed also on the affected side, or if it's too painful to breastfeed on that side, hand express or pump. Really, you definitely need an antibiotic because it is an infection. You're going to need to be treated for that. Number 4 are cysts or clogged ducts. So you can get cysts, or we call it galactoceles. This word is so interesting. I always think I can't pronounce it, but galactoceles. They are milk-filled cysts that result from a clogged duct. So basically your duct, which is the transportation vessel, like your duct is the street, in order to get to the highway, which is, highway is going to be like out and into baby. But a clogged duct is just blocked with milk. That milk pools, but the rest of the milk that's coming behind continues to pool in that area. And now you have a galactocele. And that is, sometimes it's able to be removed with like warm compresses, continual breastfeeding, hand expression, those such things. But sometimes you do need to get a go see a doctor. Sometimes you do need to go see a doctor and then get the cyst or clogged duct manually removed. So aspirated. So you take a needle, they take a needle. You don't take a needle. Do not take a needle. Do not do this at home. Go to the doctor. Because if that cyst is not treated, sometimes you can end up with an ulcer. So it can become ulcerated, and then you have an opening in that tissue, the breast tissue, that needs to then be healed. Not a fun time. It's not gonna be your birthday, okay? It's not gonna be, you know, party on you. It's gonna be a bit uncomfortable. So paying attention to signs and symptoms, again, red area. You know, it's more like a centralized area that can be a little bit more swollen than the rest of the breast. It stands out. It's red. It's can be warm, but it's oftentimes a lot smaller. The red area is a lot smaller than if it was mastitis. Mastitis, sometimes it's more of the breast than if it was a clogged duct or a galactocele. And then number 5, we have Raynaud syndrome. So I don't know if anyone has heard of Raynaud syndrome. This is very common in some people that have vascular issues. Basically, your blood vessels constrict when they are exposed to cold temperatures. A lot of people don't know that with Raynaud, that can also occur to your nipples. So your nipples, when they're exposed to cold air or something like that, or can be other stimuli, maybe after feeding or something like that, compression of the actual blood vessels, they will constrict down and become white and painful because of that blood constriction. It is temporary. The blood does return, but it's almost like an adverse effect to cold. It is treatable, it's not curable. So for it, a lot of times we will say do warm compresses. You can do that during, immediately, or after, you know, breastfeeding, and it can occur at any point, like before, during, or after breastfeeding also. Raynaud's, you know, because I'll give you some pictures to see what they look like, but very simple. It's not your birthday, again, but it's also not the worst day either. These are just 5 common things that you see with breastfeeding that are normal. We talk about all the time. We see moms with them all the time, but with a little bit of like education, understanding, call your doctor. That's the thing. A lot of times people don't want to call their doctor. Baby, call your doctor. It's normal, and get the treatment that you need. A lot of moms want to thug it out. They want to be, you know, super mom of the year, and it's okay to have that desire, but within means, and get yourself seen, treated, so that you can be better for you, yourself, and your baby. All right, so those are 5 horrible things about breastfeeding. Okay, thank you for coming back and tuning in for Breastfeeding with Jazz.